ultimately for physicians, it's all about owning that first impression online. First impressions no longer happen when someone calls your office or walks into your practice. They're now happening online on the first page of Google. And if you think about it, a patient that's referred to you or an institution that's considering hiring you, even a journalist that's looking for an expert to interview, the first thing that they're going to do is they're going to go to Google and type in your name. And so when you Google your name, it's really common to find two types of results for physicians. First, typically what shows up at the top of the Google results is going to be their practice or institution website. And that's not a bad search result to have. I would actually encourage that to be one of your top results that comes up under your name. But the second typical result is an online review website. And these typically fill up page one for physicians. And you probably know what I'm talking about, Morgan. It's the health grades, it's the vitals. Most of these review profiles are often not filled out. And it's really leaving it up to others to control that first impression and control that narrative for you. And so you can be proactive in positioning yourself as an expert and a thought leader in your field with that first impression. And you want to give them a reason to pick up the phone and call or walk into your practice or office. So if you Google your name and you're not making that first impression, really what you're doing is just positioning yourself as a commodity, and there's nothing to differentiate you from others in your field. So the top number one thing that I can encourage all physicians to do is really to own that first impression moving forward.
And, what are some common marketing mistakes that physicians can make while building and maintaining their brand?
There are really two big mistakes that we typically see physicians make. The first mistake, many physicians think that the institution or the practice they work for should do all the marketing for them. And yes, that's absolutely important, and they should feature you in their marketing, but there is a really strategic advantage to you positioning yourself outside of that corporate brand to act ultimately as an on-ramp to grow that business. So you are acting as that entry point from a marketing standpoint. And if you have a strong personal brand, it really accelerates that speed of trust with prospective patients the way that an institution can't. Now, the second mistake that we see physicians make is they tend to get overwhelmed when trying to do all of these marketing initiatives at once, especially if it's focused on the personal brand. And physicians have one of the most demanding jobs in the world. So we understand that time is limited for a physician. Now, not all marketing initiatives have to be done at once. And that's the biggest thing I want to emphasize. Really focus on learning one social media channel at a time, becoming really confident, using it strategically. I'd rather you spend your time on one channel than spending it across several channels and not having any traction. Maybe look at starting with buying your website URL and building it over time. It doesn't have to be built within this year. You can go ahead and buy the dirt and build it over time. Also look at optimizing your LinkedIn profile to act as your home base for now, which I'll talk about the importance of that. But whether it's starting with LinkedIn, whether it's starting with Twitter, start in one place, get really good and comfortable, really strategic before you move on to the next initiative.